In everything you do, there's an understanding of the greater good. And that greater good ain't always you or the people in this company. It's really the communities where we live every day. We're here for the greater good of the community, not just the survival of this business.
Okay, because what I do, in case you guys know, so what we have, we're going to start over. My favorite pandemic word is pivot. In the last 3 years, I use that word a lot. So we are going to pivot. So for those of you that are watching in the Red Heart Mamas group, and I'll kind of give you a little background, we have some guests here in Zoom who are going to participate in our doctor chat with Dr. Susan Demchak, which you guys are going to love this conversation. We were talking before we came on, and so much great information, and you're going to be able to ask your questions, which to me is really, that's like the icing on the cake. Sorry, didn't mean to make you crave sweets, but you know, that's the great part. And then I'm going to be monitoring this. So we're live streaming this now in our Red Heart Mamas group, which is a private group for women, by women. It's a national group, and we're live streaming it in our private group. So if there are those of you either on the Zoom call or in the group that you want to ask a question, but you don't want it necessarily included in the YouTube video, when we edit this down for YouTube, we can take those questions out. So we want you to be free to ask anything you want to ask when it comes not just to women's heart health, but your overall health, mental health, all ties in together. So without further ado, I want to first of all say thank you to Comporium for sponsoring our digital series. We really appreciate you for doing that. They sponsor those. And I'm going to bring on Dr. Susan Demchak. You look beautiful tonight. Look, she looks so put together.
Well, I did make an effort for you, Sheila.
Well, thanks. I know you've had a long day. I cannot imagine what your schedule is like. And thank you for taking time out of your busy day to come and share with our ladies this evening. And one of the things that we love to do is, just to kind of get to know you better. There may be some people who are watching this on Facebook Live or in the replay, or they're with us here on the Zoom call, and they know who you are, but they may not know much about who is Susan Demchak. So share with us for a little bit. Tell us a little bit more about you.
Well, I am from Rock Hill, which apparently is remarkable because people are always saying, I have never met anybody who's actually from here. And I think there's a lot of us who are actually from here. But so I grew up here, and the Rock Hill that I grew up in is a lot different than the Rock Hill that we know now. But it was great then, and it's still great. I went to the College of Charleston and Medical University of South Carolina. So, I'm the product of South Carolina public schools, starting with McFeet Laboratory School in 1973. Sylvia Eccles was my preschool teacher. And all the way through, I guess you could even say I went to a, quote, public school residency because I was trained in the Navy. And I met my husband. I did a OBGYN residency at Naval Medical Center, Portsmouth, and met my husband, and then spent some time at Camp Lejeune before deciding to move back here because I still have family here. So I have deep roots in this community, and Rock Hill is very important to me. And it is a pleasure and an honor to take care of women here. And most days it feels like I'm just kind of going to work and sitting down and chatting with my friends. And sometimes we have to have very personal and talk about very personal things and do, personal exams. But for the most part, I just feel like I'm sitting around talking with my friends about their lives and trying to tell them how to be healthy and getting to watch them gestate healthy babies, hopefully. And then, the most exciting part of the job is getting to deliver babies. And that never gets old. Now, doing it in the middle of the night, yes, that got old. So fortunately, I don't have to do that too much anymore. But really, it'll be a sad day when I stop delivering babies. But, a nice day in the office with a few pap smears, that kind of thing, that's good too.
So just out of curiosity, when did you decide that you wanted to grow up and become a doctor, and then you chose, OBGYN?
Well, Sheila, that's a funny question. I think my dad was like whispering that in my ear when I was in my cradle. And actually, I remember him telling me, I said I wanted to be a nurse. And he said, you should be a doctor. And I said, no, I want to be a nurse. So I was probably like 5. And he said, why do you want to be a nurse? I said, because I want to wear one of those hats that nurses wear. And he said, if you are a doctor, they will allow you to wear that hat if you want to. And I said, okay. And of course, there were probably lots of things between then and the time that I actually decided. But I will say, one of my sisters had a baby when I was in kindergarten. And so we went to the hospital and saw the newborn nursery and you had to watch it on a little closed circuit television. You didn't actually get to go see the babies. You saw them, but you could see the newborn nursery. So I went to kindergarten, and instead of having the home living section, I set up all the little baby dolls on the stove and counter, and we played newborn nursery instead of house. So I think I probably at a very early age was kind of, interested in, taking care of things and interested in babies.
Now, if you had played mommy and daddy and delivering the baby in kindergarten, that might have been a different letter home.
Well, I did tell somebody, I don't know how old I was, but I guess my mother was kind of going through some issues, and I was overheard telling one of my little male boyfriends, at the table that my mother had to have a DNC. The teacher's like, what?
Not the Democratic National Convention, by the way. That's not
no, dilation and curettage. I didn't tell him all about it, but, so I was interested in medical things at a very early age. The first baby I ever saw delivered I was a labor coach in college at the Florence Crittenden home down in Charleston, which is, I don't know if you're familiar with that, but, at that time they would have young girls that would come and live there, and they would take care of them and make sure that they got prenatal care. And they would call, you'd be a college student on call, and you would go and sit with them during delivery and hopefully coach them. And so when I saw that, I was like, that is really cool. I think that I'm very interested. That was the year before I went to medical school. And after that, I think I was kind of, hooked. I tried to really like everything, and I kind of did. I liked all the different subjects, but just the thing that interested me the most was pregnancy and babies and moms and all the gynecology that comes along with it.
Well, it's absolutely so important, and not to disparage our male gynecologists whatsoever, but I know sometimes, as a woman, talking to another woman about woman-type problems, woman-type issues, it would be like a man trying to explain some of the things that they go through, which we have husbands that are aging. And so, all those conversations. Mm-hmm. But sometimes having, I don't know about you, but probably with you, it was a lot different. But I remember back, and if my mom's watching this, I'm just going to go ahead and apologize. Our talk of life was, here's a book, read it, and let me know if you have any questions. And then, of course, that was about the time I'm 61. So that was about the time they began to have the health talk in school, which was still pretty benign. But, there were a lot of things that because my mother did not receive that information from her mother, who was an LPN, by the way. And you have that generational cycle of not sharing information at one time, having those types of conversations. In the Southern women, you just didn't talk about certain things, even with your mom. So you go through things as a woman, not really understanding them or how to ask them or even, how to approach those things. And so today, I hope, with my daughter and now my granddaughters who, are entering womanhood, that we're a lot freer and open to have these conversations. And I'm so glad that you're with us, because I know you're one of the things that I really admire and appreciate about you personally is, I think for a lot of us older women, myself included, our experience has been largely when you go to an OBGYN, it's bikini medicine. It's like if it doesn't revolve around reproductive organs, some of the older doctors, you just didn't discuss anything else. But I love the approach of talking about the holistic, of talking about nutrition, about mental health, how everything about the woman, it's not just our lady parts. It's everything that makes up who we are. So I'm really excited to have you, especially with it being Heart Month and tying all that back in. So, and I know you do have children of your own.
I do.
Okay? You do. How old are they?
They're not children. They're not children. They're men. One of them will be 20 next week, and the other one will be 23. But getting back to talking about, and I have amazing partners, period, all of them. And especially, I love all my partners. The older partners have been such great mentors. And, but when I had a baby and lactated, I realized it's like, if I know as little about menopause as I do about, or as I did about nursing until I actually did it. Now, the learning curve is steep. You learn really, really fast, thank goodness. But it is a lot different understanding the physiology of lactation and nursing and actually feeding a baby. So I admire them very much, because it's almost like, they're speaking a foreign language. Whereas at least, I kind of, I have the equipment. So I kind of, number one, that gives me a little bit of credibility, but it also, it's like, oh, okay. So this, they're not lying, there are certain things that happen that'll be like, oh, wow, the women were not making that up. That really does happen.
Yeah.
But what, Heart Month, a little OBGYN joke. We are very, OBGYNs are very appreciative to the heart because it pumps blood and antibiotics to the uterus. So obviously the heart is very important. But what I have learned about just regular medicine has been out of necessity, just because insulin resistance, polycystic ovarian syndrome, hypertension is so common. And unfortunately, our primary care physicians are so swamped that very often it's a matter of necessity. Yeah, I want to get somebody started on a hypertension medicine. I don't want to wait however many weeks it is for them to get in to see their primary care physician, because some of them may not go. They're busy. They had to get a day off to come to see me. But I appreciate very much my patients coming to see me. I want to screen them for cervical cancer and breast cancer and talk with them about bone density. But when someone comes to see me for their pap smear and their blood pressure is like 160 over 110, it's like, your heart is what's going to get you. Because that's what gets most of us. And we need to do something about this, like right now. Or, like we were talking about earlier, smoking, yes, smoking does increase your risk of cervical cancer. It increases your risk of osteoporosis. But the thing that's going to get you first is your heart, probably. So there is a lot of opportunities for cross promotion, heart health and women's health. And just historically, the fact that women have been so neglected as far as research and funding for research for prevention and detection of heart disease, and just the fact that our symptoms can be so different. And that's why, what you're doing is so important, spreading awareness, and then also trying to help people fund getting screened if they don't otherwise have the means to do so.
Absolutely. Well, I tell you what I'm going to do. I'm going to turn the platform over to you. And as Dr. Susan Demchak, talk to the ladies. When you're finished, we'll come back. We'll open it up for any questions. If you want to take questions while you're talking, I'll just let you decide what you're comfortable doing. And feel free to share your wisdom with us about what we can do to keep ourselves healthy as it relates to our heart health, our reproductive health, our mental health, and just, we'd love to hear from your heart.
Well, so that we don't run out of time, are there any questions that have been put forward in the chat already?
I am looking. I don't see any yet. We do have several that are watching us through our Facebook program. So if you all have any questions, feel free. If there's somebody here in Zoom that wants to ask a question specific, go ahead and you can post that in there, and we will ask Dr. Demchak. So I guess we can kind of start off with a question, if you don't mind.
Sure.
Because I know you see people of all ages. Typically, by the time I'm talking to a woman in her 40s and 50s, she already has the metabolic syndrome. Heart disease is already there. And so a lot of what we're trying to do is to reach those younger women, to talk to them about what you can do today so that we're not having this conversation with you, in 10, 20, or 30 years. What would you say to the younger women who come to you for advice?
Mediterranean diet, Mediterranean and DASH diet together are protective, apparently, for dementia, which I am more fearful of than heart disease. but however, the good news is that the same things that you do to prevent dementia, you also do to prevent heart disease. So there's what you eat, avoiding sugar and trans fat. There is 150 minutes of exercise per week. I think you and I had a conversation a few years ago about, yes, it's good to walk your dog. Anything is better than sitting, but ideally you want to be doing an exercise. I was in a conference this weekend, and the way he described it is you want to be doing an exercise that you couldn't sing and do the exercise. And a few years ago, you and I had the discussion about growth hormone and how that is the fountain of youth. And when you are exercising and sweating and huffing and puffing and doing something that makes you uncomfortable, that is when your brain is that's when your pituitary is going to release the growth hormone. We don't make that normally at our age. So that is where the anti-aging benefits of exercise come in. I will have to double check my data, but I want to think I either read or heard something recently that weight bearing exercise, lifting weights, is actually more cardioprotective than cardio. Obviously, you want to do your cardio because that's how you build your endurance. So 150 minutes a week of movement, ideally some of 75 minutes of that, something that kind of makes you huff and puff, and then also lifting weights. I'm a big fan of yoga. That can hit everything. That's body weight exercise. It is flexibility, balance. Balance is huge at any age, but obviously it's going to hurt a lot more if you fall down when you're 61 than it does when you're 22. And I tell people when I'm talking to women with osteopenia or osteoporosis, the best way not to break a bone is don't fall down. So, and the best way, there's several different ways to avoid that. So there's avoidance of alcohol, more about that later. There is looking around your house to see if there's something that's going to trip you. Do you have a dog that's going to drag you down or cause you to fall? And then there's your exercise, building muscle and also working on your balance. So those are things, I have a lot of discussion about, weight-bearing exercise. There is something protective about lifting weights when it comes to dementia. So I'm definitely a big fan, and obviously I'm married to a competitive power lifter, so I hear a lot about lifting weights. And I see a lot of plotting as to, how can I lift heavier weights? You don't have to lift heavy weights. You just, resistance bands are fine. Another thing that I think you talk about a lot is the blood pressure, blood pressure screening for diabetes, screening for cholesterol. And if any of those things, come up positive, addressing it, addressing diabetes or pre-diabetes. And, you're talking about metabolic syndrome and insulin resistance. I never thought I would prescribe as much metformin as I do, but that is a very common medication that I prescribe. Metformin, birth control pill, PCOS, metformin, birth control pills. In pregnancy, we're using metformin a lot. Addressing insulin resistance, and just even a small weight loss can, even a 5% weight loss can reverse diabetes and reverse the effects of the metabolic syndrome. So it's not, we don't have to build Rome, stopping smoking, trying to reverse metabolic syndrome or get the A1C down to a normal range or close to a normal range is going to make an enormous difference. And insulin resistance is one of those things. It's like putting gasoline on a fire. Your insulin level's high, your blood sugar's unstable, you crave carbs, you eat carbs, your blood sugar goes up, your pancreas kicks out a bunch of insulin, blood sugar drops, and the cycle goes on and on and on. So it's one of those things that once you do, and I'm not a fan of keto, because a diet should be balanced. So I think keto has its place. It's a good diet as far as insulin sensitizing. Keto in the first phase of South Beach, when I've done the first phase of South Beach, I put a Hershey Kiss in my mouth and it didn't even taste good. And it was like, wow, this, there really is something to this. So it's a lot of work. It's like you said a few weeks ago, good health is not default. It's a lot of work, and it's making those same choices every day. And then if you have a day that you don't make the right choices, then the following day you kind of get back on your wagon and you move forward. So it's a lot of work. It's like everything else involved in adulting.
Well, and you and I talked before, a little bit before we started the program. So far, we don't have any questions, so we'll just keep chatting. But we talk about prenatal care,
mm-hmm.
and one of the things that we really try to stress, especially with women, because honestly, when you look at any organization that goes into, say, a third world country or into a poor country to make an impact, whatever it is, if it's bringing fresh water to that community, a lot of times in order to get that work started, you've got to get the women on board. If you get the women on board and they embrace it, you're going to see change in a community. Well, it's the same when we're talking about this. If you want to see a community impacted, women, we've got a lot of ability to inspire and to influence. And I don't think we always believe that we have that much influence in us, but we do. But, when we talk about the prevention of heart disease, the truth is, we're just going to put it out there. The true primary prevention of heart disease starts in childhood. It actually starts before that child is born. So the prenatal health, I know you and I kind of talked about this briefly, of how important it is for the health of that mother, really before she even becomes pregnant, but certainly during pregnancy. What are some of the things that you're seeing now among women of childbearing years?
Well, hypertension is a lot more common than it was when I went through residency. And that was one of the, I lost you for a minute. That was one of the things that attracted me to OBGYN is like, I had this idea. It's like, oh, all of these patients are so healthy. This will be easy. And so, but I didn't count on, insulin resistance, metabolic syndrome. The incidence of gestational diabetes is a lot higher with, poor glucose control. Preeclampsia, the risk of preeclampsia is worse. Not only does your risk of having a big baby or adverse birth outcome or neonatal outcome, but your risk of hypertensive disorders with poor glucose control, your risk of hypertensive disorders goes up. But just, we have a lot more women coming into pregnancy who have chronic hypertension. We now put them all on baby aspirin. If somebody is pregnant with twins, they get put on baby aspirin. So in the future, we were at my conference this week, we were kind of, saying in the future, prenatal vitamins will contain baby aspirin and metformin, unfortunately, because we are keeping a lot of our patients on metformin during their pregnancy. It decreases their risk of developing gestational diabetes and also decreases their risk of preeclampsia. So we are seeing a lot of that. And I think you and I have talked before about pregnancy being a stress test for your body. If you have gestational diabetes, your risk of developing adult onset diabetes within the next few years is increased. If you have preeclampsia, your risk of having heart failure later on is increased. And we're not even talking about postpartum cardiomyopathy. We're talking about, congestive heart failure sometime after the pregnancy. Preterm birth. If you have preterm birth, you have an increased risk of heart disease. So it is a stress test, but it's one of those things I like to tell people. It's like, it's like the ghost of Christmas future. Spirit, are these things that will definitely happen? No, these are, this is not a preordained future. You have control over this. And hopefully people are motivated by the fact that they have something to live for. And that is a little baby that they want to see grow up. And I try to tell people having the baby is the easy part. What really takes stamina and energy is managing homework and going to meet the teacher on Tuesday night at open house after you've worked all day. And there's a million little things that, that are hard about being a parent. The pregnancy, though uncomfortable, is sometimes the easy part. But in pregnancy, we kind of have a captive audience they essentially are going to come see us every 4 weeks, and then every 2 weeks, and then every week. And so we're watching their blood pressures. And then we see them postpartum. One thing that has changed that I don't know if you were aware of, instead of just the postpartum visit, we think of there's a concept now called the fourth trimester, where we, monitor people for postpartum depression, or those women who have hypertensive disorders. They may have a visit 2 or 3 days after they go home from the hospital, and then another one in 2 weeks. Just because that decreases the risk of readmission for postpartum heart failure. People with adverse birth events, hard deliveries are at higher risk for postpartum depression. We were talking about how heart health starts in utero. Absolutely, mental health starts in utero. I think you and I've talked with you about my passion as far as primary prevention of mental illness. And, that's just something that it's a thought baby. I've just started thinking about it. And certainly there are certain types of mental illness that are organic. They can't be prevented, but ideally, they can be detected, and so that the person reaches their full potential. A child's mental health is, it starts in utero, and that's with a healthy mom, just like heart health.
Somehow, Susan, we have lost your video feed.
Okay. It's telling me to start my video, but I was afraid I froze. I was afraid to do anything.
That's okay. That's okay. I thought, oh my gosh, did I touch something? But no, you're absolutely right. And I think, having those conversations, I know even with our daughters, when they're teenagers, and talking about how what we put into our bodies and do our bodies not only create healthier women, but it's going to create healthier mothers, healthier babies. All of this comes together. And when you read reports like I do that talk about the fact that, especially among our minority women, in the African American community, especially, that a lot of them are not healthy enough to get pregnant and to have children. And that to me is just a very sad thought, because at the time in your lives, in your 20s, 30s, you should be, at your best. Health-wise, activity-wise, that should be the best time of your life. And to hear so many stories and so many reports that that's not the case for a lot of women means that those of us who have this information need to share it as much as we can, and share it often. So I am so glad that you're doing that. We do have a question in the chat here. Here's the question. We've talked about younger women. We've talked about women of childbearing ages. This is: what type of doctor should a mature woman, I'm going to start referring to myself as a mature woman. I've never thought of myself as mature, but mature woman, being seeing. And what's the best way to find a primary care physician? That can be a challenge sometimes.
That is a really hard question, because it's just, they're hard. They're hard to find right now. There's a scarcity of all different types of physicians. But I would start with, word of mouth. Who are your friends seeing? As far as a mature woman, I have patients that are in their 60s, and I'm the only person that they see. And if they're fortunate enough to where they're not on any medications, or if I'm just following their thyroid, those type of things, that's fine. Sometimes I do refer people primarily from me to the cardiologist, like I said, because I'm afraid that if I, say, okay, go get a primary care physician, they're just not going to do it. It's like, well, if she thought it was important enough, she would have just, she would have made that referral. So fortunately, we have Sanger Cardiology right upstairs. I would look for somebody close to me. Literally what I do is look for somebody close to me. So, in my building, I have someone who's literally close to me, but I would look for somebody who's close by. And then just, are they available? How soon can you get in to see them? And then go from there. I would either go to if I needed primary care, I would either go to an internal medicine or family practitioner. But like I said, I do lots of primary care out of necessity, not necessarily because I think I'm the best person to be managing blood pressure. It's just that, I can get this started and then hopefully they'll follow up with their primary care and go from there.
Well, like you said, you've got them there.
Yes.
And you're absolutely right. I mean, when you're in that situation where you're going every 4 weeks and then you're going every week and you're working and you're having to take off work, it's to add another doctor's appointment onto that. It's easier to make excuses not to go, and to put that off. But it's great that you're doing all of that. And I know with women, one of the things that I don't think. Hopefully I will do a better job of preparing my daughter, although, my mother's experience with menopause was very different than my experience with menopause, which will probably be very different with my daughter, with her experience with menopause. So there's kind of like not a one size fits all talk about the M word, but for those women that are watching this or even here in the group, what advice, because as I was mentioning earlier, it's Heart Month, so there's all kinds of articles and news reports coming out about women's heart health. I'm grateful because God knows we need to get this word out. But one of the studies they talked about recently was about menopause and the effects on women's heart health and what a lot of women don't know when it comes to those things together. Would you like to address the M word? Since
Absolutely. Yeah. I love the M word. It is the thing I tell people. A lot of times people will come in and just be like, fix it. And it's like, I can't fix it. I could not stop I can't stop what's happening to you any more than I could have stopped you from getting breasts or your period when you were 12. But I can give you some options as far as how to manage the symptoms. And the best thing is, getting back to the holistic approach. Managing stress, prioritizing, because that is, a lot of times it's a time in life when you're still taking care of your kids. And by golly, all of a sudden your parents are needing your attention, and you've got a lot of expectations from work. And then you're having hot flashes and you're not sleeping. You're waking up in the middle of the night, either worrying about whatever it is that's bothering you, or you're having hot flashes and that wakes you up. And then you worry about whatever it is that's bothering you. So sometimes I will see people and they're just so miserable that I just give them everything that I can think of. And then in a few weeks, they come back, they're feeling better. And then we start peeling stuff away. Now, one thing, and remember, this is not, I am not anybody's doctor. Anything you hear, you need to discuss with your provider. However, one thing that we have been sold as a bill of goods was that hormones are bad. Hormones are dangerous. You will get breast cancer. You will have a heart attack or stroke. And yes, there was a very flawed study that came out in July 2002. I was on vacation at Ocean Isle Beach. I can remember, it's kind of like when JFK was shot. Where were you when you heard the results of the Women's Health Initiative? And I could hear my phones ringing and all my patients down at Camp Lejeune, which I didn't have that many menopausal patients. But when I went through residency, when somebody came in, their only complaint might be that their period had stopped. And we were kind of predisposed to put them on hormones because that's just what we did. And we thought we were, in addition to helping with hot flashes, we thought we were preventing osteoporosis, and which maybe we were. And we thought we were preventing heart disease. So we know that hormones are not indicated for primary prevention of heart disease. However, when you take a group of women who get started on hormone therapy within 10 years of menopause, so quote, a young menopausal patient, and she has no contraindications to hormones, and say she's had a hysterectomy, so you put her on estrogen alone to treat her symptoms, she actually has a lower relative risk of heart disease. In Black women on estrogen only, they have a lower risk of breast cancer. Why that is, I don't know. I just know that is what the, further drilling down on all that data that came out in 2002, that got lots of publicity. Some of these other things I'm talking about you just haven't gotten the same publicity. And so unfortunately, I think a lot of people in the last 20 years have suffered unnecessarily because either they or their doctors were afraid of hormones. So of course, someone with an intact uterus, if they're being treated with hormone therapy for vasomotor symptoms, meaning the FDA indications for hormone therapy is for treatment of hot flashes and genitourinary atrophy, those type of things, the chances of them having a stroke or a heart attack from being on hormones is relatively low. And that is even more so when you use a hormone patch. Transdermal delivery of hormones seems to be safer, or estrogen seems to be safer than oral or, through the GI tract. So the thing I tell people is if you are having symptoms and you're miserable, don't be afraid of hormone therapy because it'll make you feel better and you may get some benefits out of it. For example, decreased risk of heart disease, decreased risk of adult onset diabetes, decreased risk of fracture. And your quality of life is going to be better. So that is something that I hope that people are going to know. Certainly there are people who can't use hormones if they've had breast cancer, if they have heart disease or thromboembolic disease, they're not a good candidate. And in those cases, we have to come up with something. We use Effexor or, we use generic Effexor or Paxil, those kind of things to kind of cool those hot flashes down because, they're coming from a part of the brain. Sometimes the SSRIs help with that. But the most important thing, again, is how we started eating healthy, minimal sugar. I said we would get back to it, but we haven't, moderate or minimal or no alcohol use. Alcohol use is very hard on women. To be considered a heavy drinker as a woman, 8 drinks a week. To be considered a heavy drinker as a man, 15 drinks a week. So it should be one of those things, kind of like a special treat if we're so inclined. But it's hard on bone density. It's hard, it affects, glucose metabolism. It increases cancer risk. It always makes me a little bit sad when I see the pink beers for breast cancer awareness. But hey, they mean well. So just remember that is, kind of something that we need to, minimize. The exercise, flexibility, moving, all of those things. And even people, getting back to the dementia, even people who are mildly cognitive impaired already get improvement with exercise and strength training.
We have another question in the chat here. It says, after my hysterectomy, the nurse practitioner said that I no longer needed to see a gynecologist. What's your opinion on that?
Still would. If you have not had cervical dysplasia or vaginal dysplasia, you may not need to see or you may not need a pap smear. But I mean, that is a personal choice. If you want to get all of your healthcare in one spot, we recommend definitely a clinical breast exam at least every other year, definitely a mammogram every 1 to 2 years, which obviously we don't do the mammogram, but sometimes when you're there getting your clinical breast exam, you get reminded to get your mammogram. Honestly, if you've still got ovaries, there is no great way to screen for ovarian cancer. In fact, we just talked about that at the conference that we had this big long lecture about screening for ovarian cancer. And then we finally get to the end. It's like, and there's just no great way to do it. But a pelvic exam is going to be, better than nothing. Screening for things like vulvar display, having somebody look down there. I mean, you're looking yourself over for freckles, right? I guarantee you your dermatologist is not going to look down there to see if there is something that looks like it needs to be biopsied off. So, I mean, it's a matter of opinion. But if it were me, I would still see a gynecologist periodically and just have them take a peek. And, and most people have a reason, it's in menopause, there's either dryness or there's some type of discomfort. And they want to come in and just talk to somebody about it.
And sometimes, I think we go back to that relationship conversation. When you've had a doctor who has seen you through your childbearing years, into your premenopause years, into your menopause years, and then, as we get older, nobody really sits us down and says, okay, girlfriend, now that you're in your 60s, this is all going to start up. You're going to be dealing with a whole different set of issues than you did in your teens and your 20s. There's not the talk after you get to a certain point. Thank goodness for Google, WebMD, right. But I think going back to that relationship question, if you have a good relationship with your OBGYN, and that's where you're comfortable going back to have those conversations, I think you're right. I think it's personal choice.
Yeah.
I think it's what you're comfortable with.
And another thing that we haven't gotten around to, has Red Heart Mamas talked about sex after heart attack?
No, we haven't, but I've been told it's good for you after a heart attack.
Well,
as long as you can climb stairs, you gotta climb the stairs. Yeah.
Well, I mean, it's just, it's an intimacy builder, so obviously, but your dopamine and all of those neurochemicals and, having orgasms is good. And and not that everybody is a sexual being, I always, if people aren't having sex and they're totally okay with that, I'm certainly not going to tell them, oh, well, then you need to do that. But sex drive is kind of the canary in the coal mine. And although it's definitely reasonable not to have the same drive that you did when you're in your 20s, because Mother Nature knows that you're not having babies anymore. So she doesn't need to give you this big sex drive like back then.
Sure.
But, you do, my questions for people who have, questions about sex are, when it happens, do you enjoy it? Is it painful? And then if that's the case, then we have to investigate that. And then if they're asking about their sex drive and they are enjoying sex, it's like they don't have a great drive, but when it happens, they enjoy it. I say, well, then you need to do it more. It's kind of like exercise. You may not be like, oh yeah, I'm craving some exercise, but when you do exercise, it's like, oh, this is good. I should do it more often. Same with sex. So it's one of those things, just making sure that people understand that is important. And some people don't feel comfortable talking about that with their internist or their cardiologist. True. So, you just have to find somebody and sometimes it's a long conversation. And unfortunately we have a lot of patients in a short period of time to see them, but it is an important conversation to have, because if it's important to her, then it's an important conversation.
Absolutely. And like we said, all through the phases of our life, things change and our attitude toward things change. And sometimes we wonder, are we the only one that feels this way? Or are there other women that feel this way? Did I miss something in the Cosmo magazine 10 years ago I should have known about? But I think, having somebody that you can have those conversations with and you can be open to is another reason to have that doctor that you feel comfortable with. But you're right. There are some physicians that you just don't feel comfortable having that conversation. It's like, yes, we're going to talk about heart, but we're not talking about the rest of the stuff. But I totally agree with that. So thank you. We have a couple of minutes left. Anybody on Facebook Live or here in the Zoom chat, if anybody here that's with us on Zoom wants to come on camera, unmute, ask Dr. Demchak a question. This is Dr. Chat. Feel free to do that. I think they're being a little shy, or maybe we've addressed a lot of the questions they had just by talking through things. But as you have aged, and I know, by the way, happy birthday!
Thank you.
Happy birthday! You're still
happy Mardi Gras birthday. How many people get to have their birthday on Mardi Gras? I should have gone to New Orleans.
That would have been too cool. But as you have aged, even being a physician, of course, you knew a lot of things along the way. Is there anything that you've learned about your own self as you've aged? Because, you're still younger than I am, a lot younger than I am. But
not much.
Enough. But is there anything that you've learned throughout your life that kind of surprised you, even though you are an OBGYN?
Oh my gosh. The biggest thing that surprised me is that your vision gets bad. It's like that's really, honestly, that has been the most surprising thing. However, I will say that a lot, I've been very blessed. I have had really good health. I don't suffer from a lot of the problems that my patients have as far as heavy bleeding. I got a Mirena IUD after my 20-year-old was born, and I hadn't had a period since 2004, and I hadn't missed it at all. And so I have been very, very blessed in a lot of ways. I will say that just feeling good. One thing, things that I used to go, we had something going every single night, during the kids' years. And then I was on all of these boards and doing all this volunteer work. And I just can't do that anymore. And I just have discovered that I'm happier when I spend some time at home. And I just don't have it in me the way that I did, 10 or 15 years ago. And it just is kind of just checking in with myself and, and also cutting down on activities to what gives me the most joy and what I have where are my gifts and my talents oriented and trying to put my attention there. So, there hasn't really been anything physical yet that has been that shocking, but just the everyday wear and tear on your psyche and your, and just fortunately we're living in an era of mindfulness where it's like, okay, stop and figuring out, stop and think about what it is that's bothering you. Mm-hmm. A big oversimplification would be, if you've got an itch, okay, you scratch the itch. but it just keeps itching. Okay, well, I'm going to take some Benadryl, I'm going to put some hydrocortisone on it. It's still there. Okay, look at the spot and see, what does it look like? Is and if you've got a little mosquito bite, are mosquitoes getting into the house? How can I stop those things? So just kind of, that's a big oversimplification, but I think where I'm going with that, just trying to sit down and put some thought into what's bothering me and is there something easy that I can do to fix it, or do I need a major overhaul, or is there something medically wrong? That kind of thing. And we're living in a time where people are starting to think more holistically that way. And, and hopefully medicine eventually won't be completely siloed, where I'm over here doing my, vaginas and uteruses, and, the cardiologist is over here doing his thing, and the orthopedic surgeons are doing their thing. And because there is a lot of room for cross-pollination.
Oh, I totally agree. And I think what you just described is the journey that we have as we age and we learn and we get a little wiser. If we could just, pass that on. So the last question I'm going to ask you, and thank you again for being with us, is always one of my favorite questions that I think I ask myself and ask other women. But if you could go back to your younger self, to young Susan, what advice would you give her?
Just be easy on yourself. You're not going to do everything, you're not going to do everything right all the time. And, be easy on yourself and be easy on other people too. Have more grace for myself and for other people.
That is great advice. It really is. But thank you so much for giving us your time.
Thank you for having me. It's always fun to chat with you.
But we're going to have to do it again. And for those that are on Zoom, on our Facebook Live, thank you for joining us. If you have questions, feel free to post them in the group, and we'll pass those along to Dr. Demchak. If you have an idea for a subject, something that you would like to learn something about, and you say, hey, look, can you bring her back? Because I'd really like to know about this and get her to talk on a subject. I know she'll come back. She would love to, right?
Sure.
Yes. Well, thank you all so much for joining us. This has been Dr. Chat. We are so grateful to have had Dr. Susan Demchak with us this evening. This will be available for replay, and as soon as I get the edited version down on YouTube, we'll have it out on YouTube that you can then share with your friends. But thank you all for joining us. Don't forget to visit the hearttoheartfoundation.org. Lots of free heart health resources there. If we can provide anything for you, let us know. We are partners with The Heart Truth, and we have access to a lot more information that we can share. And feel free to share in the group if you have ideas for things, or if you have questions. We can always pass those along, but we would really love to hear from you all. If you're watching this on YouTube, make sure you hit the subscribe button so that you'll be notified if you hit that little bell whenever we post a new video. So again, thank you, Dr. Demchak, and good night, everybody, and happy Heart Month. Remember, the better you love your heart, the longer it can love you back. Good night, everybody.